Hello and namaste, guys. I am Dr. Anushruti and I am here with an esteemed guest today. He is a physical therapist who believes in supporting physios through humorous and educational content. He is none other than Dan Chang, aka the Flexing Physio, who's joining live straight from Melbourne. Hi, Dan. How are you?
Hi, hello, how are you? It's such an honor to be asked to be on your podcast. I've listened to your episodes and I really love what you stand for and all the guests you've had on there. I feel very esteemed to be on your show. So thank you for inviting me.
Thank you so much, Dan. Thank you so much. Well, you have told me, and we have got to know that you are working really hard to make all the physical therapy students specifically have a great life. Is this right?
Yes, that's correct. Because I'm actually still quite young in the whole physio world. So I only graduated 3 years ago. So I'm based here in Melbourne, and I graduated from University of Newcastle, which is in New South Wales, Australia. Beautiful city. If you guys haven't been before, lots of beautiful beaches. I'd say best in the world. So definitely go check it out if you can. So as I said, I'm still relatively young in the physio profession, and I just found when I left university and started working in private practice, there was so much that university couldn't teach me. So I don't want to say university did a bad job. They did a fantastic job setting me up, but the actual what work life is actually like, it was completely different. So I just want to help, I guess, spread awareness and help as many students and new graduates as I can through my content. I try to be as realistic, and as you said, I try to have a humorous twist to everything that I
Yeah.
do, because I think humor is a great way to connect with people. So that's what I do.
Kudos to you. That's such a nice way, of exploring your own career and helping others. With
Thank you.
this, my first question to you is, what is one of the biggest mistakes that you have done and you got the biggest lessons of your career when you were in your medical school that you would like to give to all other students who are in medical school right now?
Yeah, that's a good question. Mistakes. I've made so many mistakes, and that's part of what I love doing is to share my journey as a physiotherapist here in Australia. To share my journey with anyone who would like to listen. Not so that people can't not so that people who listen to my stuff can't make mistakes, because I think it's so important to make mistakes, learn from them, and then become a better clinician. So for me personally, when I first started working, especially when I get the patient into the room. So all my experience have mainly been in private practice. So you go to the waiting room, you go and collect your patient, whoever that may be. Let's just say Bob. Bob is a very popular name here in Australia. So you go to the waiting room, you collect Bob, you get them into your room. And what I'd do is I'd go straight into asking them questions like, so what brings you in to see me? Where does it hurt? Out of 10, how much does it hurt? All those questions that university taught you to ask in the subjective history, I would just list them off, bang, 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 bang. And I felt after a few months of working, I was like, this isn't the best approach to doing a
Yeah.
subjective interview. What I found through that mistake was, instead of going straight into the questions of, all right, Bob, so what brought you in to see me? Sometimes just spend the first 2 to 3 minutes to just, in Australia, we have a saying here, chew the fat, which basically just means talk about anything, all the small talk, how's the weather? Did you catch the rugby last night? Or, just little things that kind of connect you guys as humans. It can
Less
be
is
anything.
more.
Exactly right. Yep, exactly right. So you spend the first 2 to 3 minutes building that rapport, and then I feel like your patient, after that 2 to 3 minutes, your patient eases off and is less tense. Because I think patients, when they come see physios, they still get that little bit of anxiety. Even for me, if I go and see a doctor, I get like a GP for any problems, I get a bit nervous. So I feel like it's only normal for patients to feel slightly nervous with physios as well. So that was my first biggest mistake, is I just rushed in too quickly. I should have started the consult more chill and just ask some random questions, connect with them on a human level, and then you can use that as a segue and ask them, all right, Bob, so I'd love to talk to you about cats all day, but let's talk about what brought you in here, and then go from there.
Okay, that is something you guys, everyone who's listening and watching us right now, specifically the aspiring doctors, make a note of it. Okay, Dan, another question for you. That is
Yes.
going to be a very quick round of questions. The first question is three attributes Dan feels should be in a good physical therapist.
Three attributes that should be
Attributes,
in a
yeah.
good physio. Yeah, good question. Actually, I have a podcast for my own too, and I actually have an episode on 9 traits that a good physio should have. So I'll share with you the top 3 that comes to my mind. The first trait I would actually say, is someone who is willing to truly listen. So I don't mean when I say truly listen, I don't mean just ask a question and then wait for them to finish their answer and then quickly go to the next question. If you're a good physio, I believe that you ask them a question of, so what brought you in to see me? And then you listen to their story and you show empathy through listening. Because I think if you ask them the starting question of what brought you in to see me, and you let them talk and you let them finish their story, they actually answer most of the subjective history for you. You just need to learn how to flesh out the important parts of the history. So a good physio truly listens. So that's the first one. The second attribute I would say is a humble physio, because evidence is always changing. Okay, so how they managed, for example, how they managed a total knee replacement day 1 post-op is 50 years ago is very different to how they manage it today. So if we were still to manage them the same way we did 50 years ago, our patients would not have very good outcome for a total knee replacement. So you have to be willing to change as the evidence comes out. So number 2 is being humble. I often tell any students or anyone who asks me that the problem is outside of you. So you don't attach yourself with the problem, because then ego can get in the way. And if someone tries to correct you or give you new evidence, if your ego is too high, then you get a bit defensive and you're like, no, I've done it this way all my life. This is how I'm going to do it. So put the problem outside of you, and that way it lessens the chance of you to become really defensive. So that's the second one, be humble. And then the third attribute, so what did I say? A good physio really listens. A good physio is humble. And my third attribute is a good physio will build their colleagues up as well. So celebrate the wins. If one of your colleagues has a small win, whether it be small or big, pat them on the back, tell them good job, build each other up. Because I find physiotherapy, and I'm not sure what it's like in India, but it can be very draining emotionally, and sometimes physically as well. So if you don't support yourself, then find support from your colleagues. So if your colleague does a good job, tell them that they did a good job.
And when we are saying the word community, it obviously means teamwork. So you guys really should appreciate the wins of others and even empathize with the losses of others. So yeah, this is top 3 advices of 3 attributes a physical therapist should hold from Dan. Then I would like to introduce you to one of the greatest segments of my show, that is to answer the questions my followers and viewers have asked you.
Love it.
Yes, you heard it right.
Let's
I
do it.
have a lot of questions with me, which specifically the physical therapy students have sent in for you. So shall I begin with the questions?
Great. Can I just ask, where are these students from? Are they Indian students?
Yeah, they are Indian students. Yeah.
Fantastic. Yeah, let's hear them.
So the first question is from Priyanka from Madhya Pradesh. Hi, Priyanka. Hi,
Hello.
Dr. Anushruti. Thank you for giving this chance. Thank you so much, Priyanka. Hi, Dan. I am in my final year, but my basics of anatomy are still not clear. How do I manage this? Can I clear my basics now?
Great question. Is that Priyanka or Priyanka?
Yeah, it's Priyanka.
Priyanka, great question, and that's something that I struggled with as well. Did she say she was in her final year of physical therapy
Yeah,
school?
she's in her final
Yeah,
year.
yeah. So Priyanka, I'm 3 years out, and I'm still struggling with anatomy. There is so much to cover, and it takes time. It really takes time. A couple of tips from me is to download an app on your smartphone or your iPad. It's called Essential Anatomy 5. And for me, it helped me through uni because it's an app that breaks down the anatomy. You can look at each individual muscles. And I don't know what it was like for you, but studying the forearm muscle was an absolute nightmare for me. I remember going to the library, spending many, many hours drawing on my own forearm. I used to walk out of the library looking like someone crazy. So download the app, and it helped me a lot with my anatomy. There's also good books as well, like there's the book version of the Essential Anatomy app, but I find the books are too heavy to carry around, so just download the app. Second tip from me is, I'm not sure what it's like for Indian physical therapy schools, but in Australia, in our first year of physio studies, we had a lab called the cadaver lab, or what we call the
Yeah,
wet labs.
the same.
You,
The
you
same
too?
goes over here. Yeah.
Yeah. So I don't know about you, but okay, I'm going to sound like an absolute weirdo saying this, but I loved going to those classes. For me, seeing an entire leg with all the quadriceps, the sartorius, the calf muscles, seeing them right there, literally in the flesh, and being able to feel, touch, have a look, that for me was priceless. So for me, I only had a cadaver exposure in my first year. I wish we could go back in our final year to kind of consolidate the knowledge. I'm not sure if after you graduate you can go back. You might have to message or email the uni
Yeah.
and get consent. But if you can go back to the cadaver labs, go back and have a look, and feel what a spine feels like, and have a look at what the discs look like, because there's so much theoretical knowledge, but practically it's very different.
Thank you, Priyanka, for your question. Next, we
Great question.
have Dr. Akshay from New Delhi. Hi, Dr. Anushruti, how are you? I am fine, Dr. Akshay. How are you? Hi, Chang. Greetings from India. I
Hello.
have just started my clinical journey. I am finding it way difficult than my theoretical studies. What shall I do? Is it normal to feel so?
So the practical component is much more difficult than the theoretical component. Yeah.
Yeah.
That's a quite a tough one. For me personally, I think when I went through university, for me, practical
To
was
simplify his question, I would say, Dan,
yeah.
he means that he just started his clinical postings. He is in the hospital now, clinical atmosphere now, and what he has studied theoretically in the college, in the school, medical school, he finds it's way difficult, and both of them are like different boundaries for him. So
Yeah, sure.
he's asking, is it normal to feel so? Is it happening with everyone, or is he lacking something?
I don't think you're lacking anything, man. I think it's totally normal to feel out of your depth. I mean, you come from university and learning all the stuff from a textbook, and now you have to go and apply this knowledge onto a real life sick person. Because at university, you're practicing on each other, which is mostly healthy legs and active and fit. But now you're applying your knowledge into real people with illnesses in the hospital. So I don't feel like you're lacking anything. I feel like you just have to trust the process. Ask as many questions as you can to your supervisor. Get to know, if you're in the hospital, get to know what we call the multidisciplinary team. So that's the specialists, the doctors, the nurses. One word of advice is be good friends with the nurse, because if you can get the nurse in your good books, then you're set for life. So don't make enemies with the nurses. So yeah, the nurses, the OTs, the speech pathologists, the whole team it's such a valuable time to learn how to work as a team. So trust the process. You're not lacking anything. If you feel like you're lacking in a specific area, then go home and do some extra reading on it. but don't forget to be nice to yourself. Don't beat yourself up. I mean, you're a student. You're meant to not know stuff. I mean, even as a physio, you're not meant to know everything. So yeah, don't beat yourself up, man.
So don't be harsh on yourself, Dr. Akshay. I hope
Yes.
you had your doubt cleared by Dan. We have Maya from Rajasthan. Hey Dan, I am in my first year and I find anatomy and biomechanics the most difficult subject. How do I start studying?
Anatomy and biomechanics. Yes, two very, very
I believe
confusing.
these two subjects are something, is a nightmare for most of the physical therapy students.
Yeah, I agree. I think especially for me, I love anatomy, so that wasn't a big issue for me. But biomechanics, I was never at school. I was never really good at physics and able to conceptualize in my own brain joints and how they roll in and which angle this and that. Like there's a lot of nuance and a lot of specific detail to biomechanics, which I can understand why it can be so difficult. With anatomy is just exposure. I feel like if you were to ask for my advice, I would say you've just got to expose yourself to lots of anatomy. So that's why I said before, download that app. If you have an area in the body that you're not good with, then just use that app and look at each individual muscles by itself. With biomechanics, uni again can only teach you so much, and they can't teach you everything in detail. So but we're very lucky in this day and age that we've got YouTube, we've got online masterclasses. I'm part of I'm part of a online learning education platform called Learn.physio. It's an Australian based, but there's lots of really cool masterclasses on there that covers knee OA, hip OA, lots of sports, return to sports stuff. I don't think there's a lot of biomechanics stuff in there, but definitely there's heaps of content on YouTube and on Instagram. That's how Dr.
Anushruti.
Anushruti and myself, that's how we linked up, was via Instagram. And there's so much good quality content, but there's also a lot of garbage on Instagram too. So you just got to be careful what you learn and pick and choose.
Definitely, definitely. Moving ahead, Dan, what
Mhm.
are the two exercises you would suggest to our geriatric population who's listening and watching us from various parts of the world? Geriatric population seems to be like similar in every country. So, two
Yeah.
exercises you would suggest them to continue to do so and to keep doing to have a long and healthy life.
Great question. And yes, the geriatric population, a lot of people think that exercises is only for the young, fit, healthy population, but actually that's a huge misconception. The World Health Organization recommends that everyone, no matter how old you are, should do at least 2 days of strength training a week or resistance training a week. That's 2 days minimum. So definitely the geriatric population needs to do some sort of strength training twice a week in order to keep their muscles from getting smaller and getting weaker. So the first exercise, I don't think you can beat the squat or sit to stand. So if you're listening to this, if you're most likely sitting down maybe. So just take your chair, take it outside, and just go from sitting to standing, and just repeat that a couple of times. For some people, just their body weight is enough to gain some strength. But if you're thinking, oh, I can stand up easy, I can do that 50 times, no problem. Well, then hold some sort of a weight. So if you have anything at home, like a few bricks or some textbooks, even a small child, anything, you have to be creative. So you can hold on to some weights, hold it close to your body, and then you can perform your squats or your sit to stands off your chair. And then that will help to strengthen your legs, your thighs, your hamstrings, your hip muscles, and even your lower back as well. So I feel like the sit to stand is a very underrated exercise, and it's very easy to do. And anyone can do it if you have legs. Would
Obviously.
you agree with that, or do you have another exercise in mind?
I totally agree with that. The another most important exercise, if you ask me to give them, is walking. Do not
Mm,
let yourself get in stationary position for a very long time. Take your
yes.
grandchildren, go for a walk to the park. Take your
Hmm.
grandchildren, take them to the nearest shop, give them a candy, but let your joints move. Do you agree, Dan?
Absolutely, absolutely. I think
Because
in sorry, you go.
no, no, please move ahead. Yeah.
Oh, in Australia, we're a nation that's growing in obesity. I'm not sure what it's like in India, but in Australia. So just to give you some context, prior to moving to Melbourne, so I'm currently based in Melbourne. Before I moved here, lived and worked in Tamworth, which is about 12 hours north. But that little city of about 70,000 people, in the entire Australia, we have the largest percentage of obese people in the entire
Okay.
Australia. 80% are obese. So as a nation, we're definitely getting larger and getting more and more obese. So walking is one of those exercises. It's free. For goodness sake, it's free. Just put on some shoes and go outside, soak up some vitamin D, helps to strengthen your bones as well. And because I'm Asian, I'm cheap. I don't like to pay for things. So put on your shoes, go outside. It's free sunshine, walking, and also there's so much evidence to show that if you walk, it can. I forgot what the term is. I think it's called cyclic loading of your spine. And as we know, between the spine, you have your intervertebral discs. Now, a lot of injuries and a lot of pain. There's a big burden around the world with lower back pain.
Yeah.
So if you can get that cyclic loading of that joint, motion is lotion. Okay. So if you can do that, then I think it will reduce. It probably won't cure obesity. It won't cure pain forever, but at least it will help. So that's I agree. Walking and squats, two very important exercises.
Okay. So, all my dear listeners and viewers who have grandparents and older parents at home, make a note of what we just said. Last
Yes.
but not the least, then one tip to give to each and every student listening to us, because this time is really hard for them. They
Yeah.
often have this idea that this is never going to end, this is the most difficult period of their life. So, one very quick motivational tip for them.
Yeah, I often remember back in when I was at uni, there were nights in the library I'd study, 2, 3 o'clock in the morning, with my friend, and we just look at each other, being like, "Man, do we even want to finish this? This
Yeah.
sucks." I'm not sure what was it like for you when you went through uni.
Exactly same. I can picture myself in your story.
Yeah, exactly. There was just nights where we just wanted to quit, but thankfully we didn't, and I'm here. I can be very proud and say I'm here 3 years out of uni now, and I don't regret it one bit. I would say that the little one piece of advice or motivation for the students listening to this is that physiotherapy or physical therapy, it's a very, very rewarding profession. Um, I think we have the potential to really change someone's lives. And I feel that physiotherapists are among one of the most empathetic professions there are in the world. We have the ability to, as I mentioned before, truly listen to someone's problems and try to problem solve with them, like in a collaborative approach. So physiotherapy is extremely rewarding, um, but it can be draining because you are dealing with people and people can be complicated. So be kind to yourself, be humble. But I reckon if you stay in it and if you stick with it and if you keep on learning, you're going to be a great clinician and you're going to go to work with a smile and um, you have awesome resources like this podcast, and there's so much out there that you can use and to get some help. So yeah, that's my little piece of advice for students listening.
Thank you so much, Dan. I believe this is going to bring a very broad smile on everyone's face. And students listening to us, believe me, this time shall too pass. And you are going
Absolutely.
to achieve what you are waiting for. Thank you so much, Dan, for joining in and taking time out from your schedule with us. This was such a great and fun talk. And, this is going to be a very big hit because I know all my aspiring doctors would be hearing it a lot of times because of all the beautiful tips you've just given. Thank you so much. I do believe you enjoyed this.
Absolutely. And if you guys want to follow me on Instagram, just go on Instagram, follow the Flexing Physio. I think it's called at the Flexing Physio. And, message me, tell me you've listened to this podcast. And if you have any questions, you can let me know. And if I ever come to India, I'll make sure to have a big party with all of you guys. Woo!
Definitely. We are looking forward to it very, very soon. Well, everyone who's listening and watching to us right now, this is your reminder to straighten your back as usual. Take care, guys. Goodbye. Have a great day. See you again. Bye.